As we mentioned, the president will be addressing Congress tomorrow night to get the ball rolling on plans to implement a new health care system. And House Republicans seem to be in agreement on the type of system that will replace Obamacare. One America's John Hines has more from Washington.
The clock is ticking for the GOP's repeal and replacement of Obamacare. But Virginia Congressman Dave Brat says House Republicans are already in broad agreement on what that replacement will look like.
And so we have several plans, right? Price has got a plan. Rand Paul has got a plan that's teaming up with Sanford in the House. And so there's several plans, and most of them have a lot of the free market pieces in common, right? The HSAs, the portability, pre-existing conditions, taking care of kids, making sure everyone keeps their coverage over a transition period. And so that's the good news. And then we're going to have to sort it out, right, and find out where the votes are. But the major issue is we don't want a federal-run system.
So the House GOP is in agreement on much of Obamacare's replacement, which is more than can be said for the Democrats, according to Brat.
You know, there's huge activity across the United States. The town halls we're having, the Democrats are coming out pretty hot. And one of the major concerns is Obamacare repeal and replacement. But number one, the Democrats don't have any replacement bill, and healthcare is imploding, right? I found out this week the average deductible for someone on the bronze plan is $12,000. That's just the deductible to get started to using your bronze plan.
The Democrats seem to have no plan to fix Obamacare, but that hasn't stopped Brat, a former economics professor, from offering his own healthcare prescription, which involves supersizing health savings accounts.
The HSA bill, and some folks are so positive on it, they want it to be the health care bill, standalone, where it's that powerful of a concept that if you triple the amount that you can put into an HSA, and then the major move that goes along with that is, and every economic textbook that I taught on it for 20 years, we have employer-provided health care right now. And so that's pre-tax, which is nice, but the employer is providing you that package. Underneath our HSA concept, you remove the employer provided, they give you the cash.
Brat says that the Congress ideally should act on Obamacare sometime in March, which would then give the Congress plenty of time to complete their work on tax reform before the midsummer break. John Hines, One America News, Washington.